Thank you so much, Caroline, for that warm welcome. So I want to thank everyone for joining us here today. I know we have folks across different time zones. I see some people in the chat saying they're coming in from Sierra Leone. And I want to thank all our speakers as well. We want to let you know that we realize there's a lot of competing events. There's a lot of competing Zoom meetings, and folks are really experiencing Zoom fatigue. So we appreciate you being here with us. We also want to acknowledge that we realize this past year has been especially traumatic and painful for many folks. The loss of loved ones, jobs, businesses, homes, and livelihoods has been an enormous weight for us all. Many of us have also suffered from years of disinvestment, biased treatment, and lack of access. All of this can have a tremendous impact on mental health. Part of the reason we decided to bring this conversation to you is because we've been hearing a lot about the medical implications of COVID, and recently we've been hearing a lot about the vaccine. But mental health is an issue that can never be discussed enough. So today we're going to have 4 distinguished individuals share their research, work, and observations about the impact this pandemic has had on mental health. So the format of this webinar will be presentation style. So we're going to encourage you to use the Q&A box to submit your questions at any time during the presentation. We're going to try to address as many questions as possible during the Q&A session. We're also going to encourage you to use a chat box to engage with other attendees and network, as well as share any resources that you may have. So I'm going to ask Colin to go to the next slide. Can you go over to the next slide, Colin? Thank you. So we also want to acknowledge that these topics can be heavy and triggering for some folks. So we have some resources that are shared on this slide, and my colleague Colin will also share them in the chat. These resources are mental health resources. They're specifically for the US and the UK, but if anyone is in the audience from different countries, we do encourage you to share any resources that you know of that people may use if they need some help with some mental health care. Next slide, Colin, please. And just want to give a quick head nod and shout out to Proebo. There's a lot of future programming that's coming up. Again, we'll share these events at the end of the webinar. We don't have registration for most of these events, but we do want you to check out our social media pages and follow us so you can hear about upcoming registration for these events. Thank you so much, Colin. So I'm going to pass it off to our first speaker, Ms. Natasha Edwards.
Hey, thank you. Good morning or good afternoon, everyone. I'm really excited to be here. Although Yanoh said a lot of what I wanted to cover, I'm excited to do this chat, and I'll be honest, when she said 10 to 15 minutes, I thought, oh my gosh, how will we be able to cover responding to a mental health crisis in 10 to 15 minutes? But I will say, I'll do my best and highlight what I really think is happening right now. I've decided to title this collective healing, because I would be remiss to not talk about the other things that are going on that have also impacted the global pandemic. So what I want to talk about is, how do we respond to a mental health crisis, a human rights crisis that is also happening during all of this, during a global pandemic. So a little bit about myself. I'm located here in Brooklyn, New York. I'm an assistant dean here at St. Francis College and the director of health promotion and wellness. So I'm actually seeing what is happening, how the pandemic is impacting our young people, our college students right now. And in addition to that, I am a psychotherapist in private practice that mainly focuses on working in the BIPOC community. And then I'm an adjunct professor for a lot of clinical social work programs that are preparing clinicians to go out into the field. And I'll tell you, it's been an extreme learning curve, because we are learning at the same time that we are practicing. So I'd like to share a little bit of research and some of my personal observations of what it's been like to be in the field working over the past year. We are living in a rapidly changing world that's full of trauma. It's full of painful mass scale loss. Hearts are heavy everywhere. Most people that I'm coming in contact, whether they're a student, whether they're a client, they feel helpless, they feel overwhelmed. And a lot of people are here and they're watching in anticipation, just wondering what's in store for them, right? Wondering what is next. And a lot of people are trying to adjust to this new normal, and it feels anything but normal, right? The idea of social distancing and isolation has really led to the complexities of balancing mental wellness, Individuals are dying at high numbers around the globe on a daily basis. And sadly, from what I'm seeing, a lot of individuals are dying alone. And there are many intangible losses on top of the pandemic, right? So people who are experiencing job loss, watching the social injustices and the murders, seeing conflict, seeing riots that are related to race. Understandably, that many people are in a crisis, multiple crises. They're feeling extremely overwhelmed, they're feeling fearful, and they're feeling anxious. So that's a little bit of what I hope to talk about over the next 10 minutes. So the question that was given is, is the coronavirus pandemic impacting our mental health? Well, I kind of laugh at that question because everyone knows the answer is yes. However, it really hasn't been highlighted as much as the physical impact or the death toll. So just a few numbers as a whole society. I mean, this is a global pandemic. We've lost about 2.48 million deaths, right? And then over 111 million confirmed cases of COVID. I'm going to speak a little bit about the experience that's been happening in the United States, and especially in New York, where we're so dense with people that we're still being told to quarantine and to isolate. And it really has created fear and anxiety about going out. So in the United States, you know that our death toll has just reached over about 500,000. And so as we see the need for mental health support, we've also seen during this pandemic decreased access to resources, right? It almost doesn't make sense. A lot of people are saying the fear of getting sick, the rise of anxiety. With isolation and quarantine to help the spread, we've seen the rise of depression, right? That's what happens when we're isolated and when we're alone. And then also grief, loss, new rises of bereavement, vicarious grief, right? So many people haven't directly lost anyone that they know, but just seeing mass loss is vicarious grief or vicarious trauma. And then anticipatory grief, right? Which is a form of anxiety, the fear of if I'm going to lose someone. But what I will say is this is the first time, especially in my career, that we are experiencing a collective trauma at the same time. Every single person is being impacted by the pandemic. And the pandemic just didn't start the rise of mental health disparities or mental health illness. There were a lot of people who were already struggling, and the pandemic has just made it worse, right? Because it's impacted our health, it's impacted employment, income levels, housing, and food security. COVID has really had people that are going back to basic survival and struggling with basic needs. And we know, thinking of Maslow's hierarchy, if our basic needs are not met, how do we anticipate thriving, right? Many people are just trying to survive. So some new trends, and again, the research and the data is new, but we used to say pre-COVID that about 1 in 5 adults were diagnosed with a mental illness. New studies are showing that that's about 1 in 4. So with the pandemic, about 25% of the population have a diagnosable mental illness. Since the pandemic, about 4 in 10 adults are now reporting anxiety or depression. Which has been up from 1 in 10 adults pre-COVID, right? So a real shift of people are experiencing things that they never have experienced before. And the people who were experiencing anxiety and depression, it's exacerbated. The other thing that we should look at beyond anxiety and depression is the rise of substance abuse. A lot of people are using alcohol and drug to cope, so up about 12%. Difficulty sleeping is a trend. A lot of people that are anxious and struggling with insomnia. The rise of eating disorders, right? So this idea of, well, I can't control what's happening externally, but I'm going to focus on controlling my food. So obsessive eating. And then also the worsening of chronic conditions, right? So seeing people that are struggling with high blood pressure, diabetes. I mean, think about being quarantined in a house and being immobile all day and not moving, exacerbating that. COPD, a lot of people are turning to smoking. The rise of cigarette sales are up. And liver disease, the rise of drinking and alcohol use as ways to try to make sense and cope with this mental unrest, right? And then I'll just say, we recognize that there's so many studies about severe medical conditions and how that plays into COVID, but there has not been a lot of research about the risk of people with severe mental illness. We know that if you have a severe mental illness, thinking bipolar disorder, ADHD, major depressive disorder, schizophrenia, you are more likely to contract COVID and you are more likely to die. So we know that this mental illness should also be moved as a category. And for some, for many reasons, people that struggle with severe mental illness may be homeless or transient. They might be living in congregate settings. They might be working in unfavorable or unsafe environments, right? They may be frontline workers and hospitality and have to go to work and can't stay at home and quarantine. And so my plug here is that I really think that we should make severe mental illness a category for early vaccination as well. We really look at chronic disease, but I really think there should be a push to make severe mental illness an early category for vaccination. And we found that other countries that are doing it, Denmark, Germany, Netherlands, UK, really are seeing reduced numbers in this population as well. So that certainly is my plug for a solution. Just so that you can see it on a grid. So pre-COVID, adults that were struggling with anxiety and depression in a household, about 11%. This was the year leading up to COVID. Now, 41%. That's a huge jump to go from 11% pre-COVID to 41%. And if we break it out, if you look at adults that are struggling with anxiety now, about 35.8%, depression about 28%, and most adults co-occurrently are both reporting anxiety and depression. And so what does that mean? Also, young adults are struggling. I'm speaking specifically, about young adults, because those are the population that I'm working with here at St. Francis College. And let me tell you, young adults are really struggling in ways that are scary. A federal study this year says that 40% of Americans are now grappling with their mental health, but 75% of young adults, 25 and under, report struggling. So we know that our young people are really being disrupted because students are not able to come on campus. Many students are having the burden of having to work to provide money because maybe their parents have lost jobs, and social changes, right? Imagine being socially isolated as we are still developing. We know that the brain continues to develop until 25. We also know the importance of social connection for young people, so that young people ages 18 to 24 are just reporting enormous symptoms of depression and anxiety. So about 56% of young people are reporting depression compared to all adults that are saying a very lower, the 41%. And then reporting substance abuse, about 25% of young people compared to it was 13. And about 26% of young people are saying they're having suicidal intent. And actually, it's a little bit higher. So we'll look at suicide in a minute. But when we break out just who's suffering by age range, it's obvious that our young people are struggling the most. And adults are not that far behind at 48.9%, but overwhelmingly, young people that would traditionally be in high school or would traditionally be in college are really struggling. And so it leads me to talk about really the hidden pandemic right now. We're experiencing two pandemics, a dual pandemic, one of that being obviously coronavirus, but the other one, suicide. Globally, we know about 800,000 people commit suicide every year. That's twice the number of homicides. Suicide is a real issue. But now when you increase anxiety, isolation, the fear of abuse, and let me just say, a lot of young people are quarantining in less than ideal situations. Maybe there's abuse in the home. Maybe, for a lot of the students I work with, coming on campus was really their safe place. They loved being here. They loved seeing the faculty, the staff, and their students, and now they've been disconnected from that, okay? So we recognize that the suicide rates in 2020 have been astronomical, and this is the highest that we've ever seen for individuals under 30. So about 1 in 4 young adults are reporting this year that they've struggled with suicidal thoughts. So that's about 25% of young people are struggling with considering suicide right now. In general, there's been a shift that about 1 in 10 adults are also struggling with suicidal thoughts as well this past year, which is astronomically up. So just a grid so that you can look at pre-COVID, young adults, all ages about 4.3%, and young adults about 10.7%. I mean, it's more than doubled since COVID with people that are thinking of suicide throughout the pandemic. And so who is at risk? Essentially, everyone is at risk, right? So things to look out for someone who's lost their job, essential workers, elderly, young people, victims of domestic violence and abuse, people that are homeless. We've seen that COVID, if you had a pre-existing mental illness, that it's really exacerbated it and made it worse. Stigmatized groups and people who have lost a relative from COVID are twice as likely to commit suicide. So really some people to look out for. And then just thinking of intersectionality, how has COVID impacted different populations of people? So obviously, as I mentioned earlier, we are dealing here a time of social justice and racial turmoil. And we also know that Black and brown people traditionally don't trust the medical system. So it's not a surprise that there's a disparity within the community. So although we know that Black and Latino people are more impacted by COVID, we are contracting COVID at higher rates, we're dying at higher rates, that we are also more disenfranchised and have a bigger challenge assessing mental health care. Right? So the community is really being impacted, but we're not seeing the rise of accessibility for Black and Latino people. We also know that gender is an impact, that more moms are reporting symptoms of depression, more women, 49 to 40% are reporting symptoms of depression, because women are almost doing what we call the second full-time job. We're working virtually, and then maybe at home you're a caregiver or a provider for an elderly person. Maybe you're a parent helping your children navigate being at school, but really feeling like it's overwhelming because of lack of schools being open, lack of childcare, and all the additional roles that women tend to fill. And then job loss, right? We recognize that we're in an economic slump. A lot of people have lost jobs. So people who have lost jobs are reporting 53 to 32% of people with diagnosable mental illness. So losing your job, we know, makes you more likely to be depressed and more likely for suicidal ideation. So a few systemic barriers that I wanted to highlight is, systemic financial instability. A lot of people who want to go to therapy can't afford it. It's not a priority if we're talking about paying rent or paying for food or paying for bills. The rise of seeing that people who have lost their jobs don't have medical coverage, therefore they can't go to therapy because they don't have insurance. And I'll speak as a therapist, the idea of therapist burnout or essential workers really being impacted. I say this is the first time my clients are coming in, and I'm also experiencing what they're experiencing. They're coming in and talking about, anxiety or depression or feeling a fear of being sick or how COVID has impacted them. And as essential workers, practitioners, we are also being impacted as well. So this idea of parallel processing that's going on, and a lot of therapists are burning out. The last aspect I would add is the real need for culturally competent and diverse therapists. If we're dealing with systemic barriers, if we understand that Black, brown, and the BIPOC community need more access to therapy, we need some more cultural competent and diverse therapists. That was one of the research studies that showed why people don't go to therapy, because they're not seeing therapists that look like them. After this year, a research study shows that majority of the service health providers are white. 87% of therapists are white. And so what does that mean to be able to introduce more culturally competent therapists to be able to handle this pandemic? So my last slide that I would be remiss if I didn't add, maybe it's a personal plug about frontline workers and burnout. We tend to think that therapists are immune to mental illness, and we know that that is not true. So a few grids that show that a lot of therapists, a lot of frontline workers are also developing mental illness. So anxiety and depressive symptoms, about 42%, substance abuse amongst counselors and frontline workers, 25%, and suicidal thoughts, about 22%. So again, this is a global collective pandemic that is impacting everyone's mental health. No one is not being impacted in some way. So that ends. I don't know my time, Yanoh, that ends. I certainly had some slides that I think you already highlighted. There are suicide hotlines, and there are talking and texting, because I recognize, even working with students, there are some people who they can't even speak because their family is quarantining with them. There are a ton of text lines, talk lines. If you go to suicide.org, because I recognize everyone is in a different place. If you go to suicide.org, you can put in your zip code, or you can put in your geographical area, and it will bring up your talk and text line for whatever country or region that you're in. The other thing I would just say is, with COVID, I know I talked about a lot of the negatives. One positive is there are so many apps, and there's teletherapy that now gives access to people in ways that we never had access. So I have clients that are everywhere in the world, and we're able to speak. So I would plug that, use a telehealth platform, go on to Psychology Today, find someone that is in your area or not, and now you can access someone who maybe looks like you in a different zone. Thank you.
Thank you so much, Natasha. That was really impactful. I think very eye-opening. I see a lot of questions coming in. So I just want to tell folks, keep the questions coming. We're going to get to the questions at the end of all presentations. We prefer if you put the questions in the Q&A box, but you can also put them in the chat box, and you can also use the chat box to engage with the other attendees. Thanks again, Natasha.